While some people may be hesitant to go to the hospital during a pandemic, a Webster woman is urging anyone with a medical issue to just go. She says not to wait if you think there's something wrong with you just because you're afraid of COVID-19. Kayla Green talked to her about the day last month she was put in a life or death situation.
It wasn't fear, it was survival.
July 9th started off like a normal day for Mary Helen Collins. She was in her bedroom around 3 in the afternoon when she suddenly felt weak. Collins stood up, collapsed, and couldn't get back up.
The entire right side of my body wouldn't move with me. And then something inside me told me to talk out loud. And when I tried to talk out loud, my speech was completely slurred. And I said, "You're having a stroke."
Luckily, she was holding her phone and was able to call 911. Her dog Buster stayed by her side until the paramedics arrived.
So I was screaming, "Help me, help me." I was on the phone with 911. They ended up having to break the door down with an axe.
The doctors at Rochester General Hospital told Collins she had a huge blood clot in her brain. Dr. Taka Higashimori explained how important it was for him to operate immediately.
I just looked up at him and I said, "Are you any good at this?" I don't know why I said it, but I did. And he smiled, and the team kind of smiled and laughed. He said, "I'm good."
So we were able to open up her brain vessel and restore her flow to the brain and basically reversed her stroke symptoms.
The procedure was successful, and Collins was released after 5 days. Dr. Higashimori says he's heard people express concern about going to the hospital during COVID-19, and some end up waiting.
Be in control of what you can be in control of when your body is telling you something is wrong. Don't dismiss it. COVID, no COVID. Do not lose your life over fear of something that you can't control. Control what you can. Go.
July 9th wasn't a normal day for Mary Helen Collins, but because of that 911 call, it wasn't her last. In Webster, Kayla Green, News 8.
All right, Kayla, thank you. And we should note that every single local hospital has protocols in place to protect patients from coronavirus.